know 3 in 10 Nigerians suffer from mental disorder? This figure is bound to increase in the nearest future. Today on Sound Health, our focus is on how to avert mental disorder from being a major public health threat. Stay tuned, the program continues in a moment. Three in 10 Nigerians suffer from mental health. Today I have with me Dr. Rasheed Kolade. He's going to give his expertise on the topic. Dr. Rasheed Kolade is the Deputy Director, Ministry of Health, Lagos State. Okay.
It's a pleasure coming over here.
Okay, according to a recent report by the World Health Organization, 3 in 10 Nigerians suffer from mental disorder. As an expert, at what stage do you certify someone mentally fit?
You know, the WHO declared about a month ago as a Mental Health Awareness Month. It was realized generally that the issue of mental health illnesses is on the rising side. Mostly in Nigeria, we can see that there's hardly any week or month you are not told that somebody has committed suicide due to one reason or the other. And definitely, and according to the first major cause of suicide is usually depression, followed by alcoholism and some other issues too can lead to that. It was noticed that maybe due to the economical issue with Nigeria recession and some other things, there were a lot of people that were getting into this so-called depression. And at the end of the day, what they need to do when they are tired and worthless, feeling worthless, helplessness, they found out the next thing they need to do is just to end their life and thereby committing suicide. So the awareness is being going around worldwide for people to really understand what mental health is. Because mental health illnesses is usually like, let's take Nigeria for example. We have the problem with concerning our religious background. Because you found out majorly the so-called the pastors and then the imams and alfas, they believe anything that has to do with mental health, the first thing they're going to tell the patient is spiritual. It's an attack. Is this, is that. So basically based on that too, most people before coming to the hospital, they might have gone to herbalists, pastors, imams, seeking for help. And by the time you are seeing them in the hospital, they would have gotten, they would have been like a chronic illness.
Okay. Please share with us some of the symptoms of mental disorder.
Talking about the symptoms of mental illness, they are very many. It's ambiguous. But the common one that a layman could quickly pick when somebody is having a mental illness, I'll just quickly mention some of it. There are a lot of complaints. You see that the person will be socially withdrawn. That is, the person now keeps to him or herself, not talking to anybody, wanting to be in a room all through the day. Some of them, you see them, they get easily annoyed, easily without any provocative situations. They get irritable to the extent of some of them can even be physically aggressive or verbally aggressive. Then at times you found some of them talking to themselves or laughing to selves. Some of them will be telling you they are hearing voices, which is hallucination. Telling you they are talking about me, those people there, I can hear voices talking, commanding me, or they are discussing me. Some of them could tell you they are seeing strange things that people around them cannot see. Some of them, at times, they could even get to a situation, they become violent and start attacking people. That is when you say they are dangerous to themselves and again, dangerous to the environment. A lot of symptoms, if I keep counting, then irrational behavior in some form of, because we have different diagnoses. In some, you have some pathognomonic symptoms, which means a symptoms that is really applicable to a diagnosis. Like when you're talking about the mood disorders now, on the depression aspect, the person will be unhappy. There's nothing you say that will make the patient happy. There will be a loss of interest in his or her pleasurable activities, what that person loves doing. Then they get tired easily. On the other side of the bipolar affective disorder, which is mania, you see the person, if you ask him, how happy are you? He may say, I'm 500% happy. They put on their best clothes, they spend money anyhow, buying things they don't need. They will tell you, I'm being sent to the world by God. I have this power to do this. So if we keep going on with them, when we talk about schizophrenia, those ones, their thoughts are usually their problems. Well, let me just give an example. Most of the people you see under the bridge and all those things, vagrants, at the end of the day, by the time you try to clock them and come down to their diagnosis, you find out that they are schizophrenia. There's a lot of signs and symptoms you can use to identify anybody with mental illness.
In your response, you pointed out that most patients always seek spiritual help rather than medical help. Is it because they feel it's not treatable?
Actually, the problem we have with the treatment, as I've said with the spiritualist, be it the Christian and the Muslim, is that they believe the first thing they're going to tell the relatives of the patient is that the patient is on attack, that is spiritual. He has been attacked. But one thing, the beautiful thing about it is that mental illness, most mental illness are treatable. When identified, we have drugs, injections, even the clinical psychologist coming into it, the treatment is working when they bring them there. But what we normally, I for one, when I see any one of them, I'll just tell them, why don't you go ahead with your medical treatment, then tell whoever who is your pastor or your imam, let them be praying for you wherever they are. It's really treatable. Majority of it are treatable.
Okay. According to the World Health Organization, lack of resources, shortage of trained healthcare professionals, and social stigma could be attributed to inadequate care for patients. What's your take on that? That's
actually the truth. Because in Nigeria, I don't think we have up to about 400 psychiatrists that I speak to you. And then from the WHO, a doctor ratio to a patient, we are far, far behind. So, like you have rightly said, we lack more manpower. That is, although we've been trying on mental health issue, at least for Lagos state government, there has been a program that they are trying to train some of the doctors who have focal, we call them the focal doctors for mental health in each of the general hospitals. They have been trained to identify the simple signs and symptoms of mental illness so that they could quickly send. And for the primary health care, I am very sure that they have been trained. Even some of their nurses, the main nurses, they've been trained in Lagos State to have at least the knowledge on how to attend to any emergency pertaining to mental health illness. And for the issue of the stigmatization you talk is a worldwide problem. it's worldwide. It's in the UK, in the US. Stigmatization is usually the problem. And I think in the developed countries, they have a lot of laws that is binding any patient that is mentally ill not to feel being cheated in terms of employment, which I'm very sure in Nigeria too, although, you know, we are developing. I think in Nigeria too, we are trying to do such a thing, but, you know, as a developing country, which has not been really, like the Lagos State has just passed the mental health law just recently. So with that, I think most of those things, stigmatization at work, at school places and all those things will be.
Nigeria's mental health policy was formulated in 1991 for advocacy, promotion, prevention, treatment and rehabilitation. Can you please share with us the status quo of this policy?
Mental health law is still on the table at the National Assembly, because there was a time, I can't really remember, in the early 2000s, there was a senator who is a psychiatrist that pushed in the law, but up till now, I think it has not been passed. But luckily for us in Lagos State, the mental health law has recently been passed. And I think by the time we start implementing it, maybe, you know, we should see an improvement in the way we handle our mental health issues.
Okay, Dr. Kolade, can you please give insight into the recently passed Lagos State mental health law?
It talks about treatment of the patient, being maybe when you identify it, how you go through about the treatment. It talks majorly about the forensic aspect of it, because some patients, when they have this thing, they might be very dangerous and violent to themselves, and there are ways you can quickly go to a magistrate, have a, what's it called, a warrant of arrest or admission. I think that one is inclusive too. Then the funding, then some of the way you can maybe transfer from the primary health care to the secondary care, then to the third care. I think all these things have been addressed in the law.
Are there medications or health conditions that can trigger mental disorder in people?
Yes. We have a lot of some of the other physical, other medical conditions that could trigger. Even ordinarily, hypertension could be, diabetes, chronic diabetes could be. We have some other metabolic diseases that could that could push anybody to, even we're talking about all these deadly diseases, like a patient with HIV could come down with mental health illness. We have people with TB that could come down with mental health illness. Most of the, what's it called? Most of these illnesses could lead to mental health illnesses. And again, some medications too. Some like steroids, when you are constantly on steroids and all those things, even for the sickle cell patients, the so-called the pentazocine they give to themselves could lead to mental health illnesses.
The World Health Organization says mental disorder is bound to be a major public health threat in the future if not checked. How true is this?
I remember some years back, the WHO said in the near future there will be an increase in mental health illnesses worldwide, because as you can see, by looking at some of the factors that are tilting people into this, it's a worldwide problem. Like unemployment is a general problem worldwide. The issue of banditry, terrorism, and all those things, they are also a worldwide problem. So by mere looking at all these factors, you will actually believe that yes, because you know there's something they call the post-traumatic stress disorder, which could happen mostly in places like Syria, even in Nigeria, some of the Boko Haram region, a lot of people could come down with that. So with all these things that are not being addressed, there will always be an increase in mental health illnesses around all over the world.
What is the way forward?
Awareness and advocacy. should be the first thing. We have to carry everybody along to let them understand what is mental health. And basically, because of the environment, mostly in Nigeria, because of what is happening, generally, economical-wise, insecurity, we need to let people know that, fine, these things are occurring, but basically, we don't want a double-barrel thing. You are not rich, you are having a mental problem. Then again, you are not secure, you are having a mental problem. So definitely, with all these and people, then we'll try to do some things like we call it the train the trainer. We should, all medical personnel should be told on how to manage issues pertaining to, most especially, the mood problems. When you see somebody who is down, maybe with depression, you should know how to address, not necessarily sending before you send to an expert. You need to at least be able to do some things to avert a dangerous situation that will come out of that. Then the again is that I will just want more funding from either the federal government, the state government, and even some private personnel, people who can donate money in order to a kind of revolving scheme to help mental illnesses. Then again, people, we should all we should learn from what I've said. Again, the National Assembly should be pressurized to pass the measure, because I'm very sure, if not, I think we are using the 1909 mental health law, what's called bill. I hope if the mental health law can generally be passed nationally, it will help in alleviating some of this problem you have with mental health.
As we wrap up this segment, what is your advice to the public regarding mental disorder?
Okay, my advice to the members of the public is that they should be aware that mental illnesses, they are just it's just like a illness like that of hypertension, diabetes, obesity, and some other things. First, I would just want them to know that whenever they found out that they are having some issues, instead of keeping it to themselves, they can discuss with somebody. And if the person realizes that this problem this person has discussed with me needs to be discussed with somebody, fine, you can look for somebody, then tell the person. And if there's a sign, any sign that most of the public, from most of the symptoms I've mentioned, that person realized that person has, the next thing you do is that seek an advice. Then take the person straight down to the hospital for a doctor to assess, and then come down with something, then go ahead with the treatment.
All right, thank you so much, Dr. Rashid Kolade, for sharing your expertise with us on mental disorder.
Well, you're welcome. You're welcome. I appreciate it.
Right, that has been Dr. Rashid Kolade on mental disorder, how to avert mental disorder as a major health burden in the country. Sound Health continues with trending and home essentials. Please stay with us. That's why we say thank you on today's edition of Sound Health. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at HealthTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.